Now, prostate cancer is, of course, a curse amongst men. It takes the lives of 500 men every year in this country, of course. And there is no national screening service. However, a clinic in County Kildare is now offering a one-stop shop. Now, Mary Fanning went along to find out more.
Rory Hafford is a medical journalist for over 20 years. He recently published a book on prostate cancer called Mantrap. That resulted from a television programme about the disease some years ago, when he interviewed one John B. Keane about the disease.
Men are shy about talking about that area of their anatomies, and I found that other people who had prostate cancer would not discuss it with me. A few did, and we were a great help to each other with the treatment and that kind of thing. There's a lot of little tricks you can learn, you see. And it's a dreadful embarrassment, you see, because you're dashing to the toilet every minute.
And afterwards, the eminent author pulled him aside.
After the cameras stopped rolling, he pulled me away into a corner in the little snug of a pub that he had in Listowel, and he said, "Do me a favour, I'm going to be gone in a couple of months. Ask one question, and let that one question be, why could they not have found this horrible thing sooner?" That's where the book started and spun literally all over the world, asking the same question of medics, urologists, specialists, people who knew the answers because they were working in the area all of the time.
The book is described as Rory Hafford's hard-hitting investigation into the diagnosis and treatment of the disease. His research brought him to County Kildare and the Irish Centre of Integrated Medicine. Here he found what he'd been looking for, a one-stop prostate assessment.
They have tests that are sensitive enough to indicate whether or not there could be activity in the prostate. Now, that does away with a couple of things that men would balk at, like, for instance, the DRE, or the digital rectal exam, which I know some men who would rather chew their arm off than have it. Now, men have to get over this problem. They simply have to. What this clinic does is it gets around these things and it tests directly as to whether there is or is not activity in the prostate. And that means that they can then take the next step forward.
And it's clean.
The tests conducted by a specialist GP include 5 phases.
It combines 5 different parameters: a questionnaire to work out the risk of developing prostate cancer, followed by an ultrasound examination on a full bladder, followed by a uroflow. If there's an enlarged prostate, you'll get stopping and starting, so you'll see that through the uroflow. We then do a subsequent follow-up ultrasound to see has the bladder emptied sufficiently. Then that's followed by a urine analysis, a PSA test, where we get immediate results, all within 1 hour.
The combination of the tests amount to a high degree of accuracy.
We're confident in a certain degree with each component. But if we add the blocks and we build up one, we can build up a final, unique image of what we have. And with this, we go as close as we can to 100%. I would say fairly would be 90%, more than 90%.
The results are available within 1 hour, and the PCA3, the specialised antigen blood test, takes 2 days. The file can then be passed on to a consultant who now has a definitive pattern to work from. Austin Breslin had prostate cancer, but it was nearly 9 months before he went for treatment. The delay was partly his own fault because he was afraid of the regular tests, and partly because of the number of consultants he had to see. His cancer was first noticed after a regular thermography imaging health check of his system at ICIM before the one-stop prostate assessment was available. If it was available, his attitude would have been completely different.
I would have made a decision a lot faster. Rather than, as you say, I did dither a lot. So I would have been faced, I would have been confronted with the facts, and I would have had to do something about it. If those facts were facing me there, it would have kind of shocked me or motivated me into doing something about it immediately. But I suppose I was one of the lucky people that I did have that little bit of time. Others may not be that lucky.
Austin is lucky his cancer is gone, and he has moved a step further. He's set up a counselling service for sufferers and their relatives. Rory Hafford's book is aptly named Mantrap. It resulted when Ireland's beloved John B. Keane asked why. And the man tasked with asking that question is adamant that men must exercise greater vigilance and take control to protect their own health.
The old argument about it being an old man's disease, or you're going to create an army of worried well people, I mean, to me that's a nonsense, looking at it from a simple, logical point of view. Worried well? I would rather be worried and well than terminally ignorant. I don't mean to insult anybody with that, but the hard messages about prostate screening or prostate cancer have to be got out there. And where we are at the moment, basically men are on their own.
And isn't it good to hear that men are being much more proactive about their